susceptible to fibroids? Well, this conversation will seek to answer all of those questions. It's known as uterine leptomas. I'm sure the doctor will give us the right pronunciation, and are non-cancerous growths that develop in or around the uterus. Now, they are common among women of reproductive age and can cause a range of symptoms. There are different types of fibroids. I'm going to leave it there for the doctor to educate us. And Dr. Isaac Tetesekom is an obstetrician gynecologist, and he's going to be the one educating us this morning. Doc, good morning. Welcome to the table.
Good morning.
Great to see you.
Thank you.
Great. In the layman's term, fibroids, because somebody is wondering, hey, what is this one too?
So, fibroids, the woman has what we call uterus. That's what contains the baby. It's made to be able to carry a baby or pregnancy.
Right.
Now, the uterus is like something like that. It has a wall, has the inside part, which is the endometrium. And around it, the covering around it is what we call the serosa.
Okay.
Now, the wall of the fibroid, of the uterus, is made of cells, like a building.
Okay.
The wall of the building. Now, the cells are like the blocks that make up the walls. So you can have just one block in the wall deciding to misbehave. Deciding that, okay, I don't want to remain this size. I want to become bigger. So it starts multiplying and growing bigger and bigger and bigger. So you have the wall there, and one block decides to become bigger. So it's that block begins to bulge out.
Out of the
order. Yes. So depending on where that block is, if that block is on the outside of the wall, it bulges and develops towards the outside. If it's in the middle of the wall, it bulges in the middle. And if it's at the inside part of the room part, which is the endometrium, it bulges into the inside. So fibroids are just growth, and it's one cell that begins to multiply itself out of proportion, pushing the other cells away and becoming pompous.
And in this case, because we hear cancer, cells will multiply.
Yes.
But in this case, what's the difference?
So when we say cancer, cancer are cells that have the ability to move from where they are to other places and go to cause problems there. But fibroids normally do not do that. I mean, they just remain at one place, and they don't move like that. That's why we say they are non-cancerous.
Okay. Common symptoms. Is it something that you must do a check on once in your life as a woman?
Fibroids are really common.
Okay.
When you have 10 women in their reproductive ages, about 8 of them will have fibroids.
Wow.
So it's very common. So we said the commonest symptom of a fibroid is that it's non-symptomatic or asymptomatic. It means that people don't know that they have fibroids. So a lot of women who are walking around, they have fibroid, but they don't know. And it's strange. Sometimes you can see a woman with a very huge fibroid, and he'll tell you that I've never known that it was fibroid. I mean, something like, okay, I felt like my tummy was just growing bigger and bigger. But I just didn't know that it was a fibroid. So the commonest thing is that it's asymptomatic. It doesn't tell you. But the other symptoms that are really worrying, those are the things that will bring them to the hospital. Number one is bleeding. When the fibroid grows into the room, as I was explaining, the fibroid grows into the room. And the room, that's the inner lining of the uterus. That's where your menses comes from. So when it grows into the womb, it makes you bleed a lot. So one of the commonest reasons women will come to the hospital is they are bleeding excessively.
During their menstrual period or out of their menstrual period?
Yes, so some of them will have heavy and prolonged menstrual periods. Others do have what we call intermenstrual bleeding. So before you have your menses today, before the next menses, they bleed in between. And they can bleed to the extent that they lose a lot of blood and they will need blood transfusion.
Wow.
The other common symptom of fibroids is that when they become big, they press on your bladder So it makes you feel like peeing every second. Every second, the woman has to go to the washroom. But one worrying symptom of fibroid is that it can also make you have challenge with having babies. Because if the fibroid has grown so big and it's putting pressure on where the baby can develop, then it's difficult for the baby to develop. Sometimes fibroids can grow and block the tubes. It can also stretch the tubes. Like that's what I did on Saturday, where it had grown so huge and it has stretched the tube so long that it's so difficult for a sperm to be able to. That sperm has to be a Usain Bolt. You need to move all the way to get to meet the egg. These are the challenges that fibroids do.
I saw a photo, but I'm sure my director or my producer will put it back on, and the size. So this size, is this like a tiny size? Is this like a big size?
So this is huge.
Okay.
This is huge. It looks like one of the pictures that I've seen. But these are huge fibroids, and this it goes to the extent that it's almost the size of somebody who is about 9 months pregnant.
Wow.
So when you see that, it's like the woman is like the tummy is so huge. As somebody who is like 9 months pregnant.
But she's not pregnant. And this would prevent a baby from growing.
Definitely, depending on where it is. But strangely, I've seen a lot of women with very huge fibroids, but yet they've gotten pregnant.
Oh.
And I've handled quite a number of them. So fibroid in itself might not prevent pregnancy.
And the baby fully develops?
Yes.
Wow.
Fully developed. And some of them, depending on what it is, I mean, we might need to. So now,
we're looking at?
Yes, look at this picture. You see that there are two fibroids that you can see. The white one, I mean, from what I see, there's the color.
Yes.
There's one that is bulging into the uterus.
Okay.
We call that submucosal. Call that submucosal. And there's one that is in the muscle of the uterus. So the
muscle is on the left.
The one on the left.
Okay.
That white one that we call intramural is in the muscle.
Okay.
That might not give you much problems.
Okay.
But the one that is likely to give you problems is the submucosal one. That one is likely to give you a lot of bleeding.
Inside, the one in this looks like, I always say it looks like a cow horn in a cow head. But
yes.
I mean, the one in the middle, attached to the upper part, is what will give you a lot of problem. How about the one on the outside on the right?
The one on the outside, that is, we call it pedunculated fibroid. That does not give much problems.
Okay.
How about we have what we call a subserosal. Subserosal also normally does not, unless it becomes so huge.
Okay.
But it becomes so huge to create pressure.
They must all be removed, no matter where they are lying.
So, question is that, do you need to remove your fibroids? It depends.
Oh.
It depends on what problem it's giving you.
Right.
If the fibroid is not giving you problems, you may leave it alone.
It's making your tummy big and then...
Yes, so one of the problems is that it makes your tummy big. So some people cannot live with big tummy.
Right.
So then you might have to remove it. But the challenge is that fibroids, when it's removed, can grow back. The reason being that the cell, as long as it remains there, your uterus, can grow back. But there are some people who generally develop fibroids. I mean, their cells have been made to develop fibroids.
Tell us some of the cases you have seen where it has grown back. How rapidly has it grown back?
It depends. But most people from 2 years, they start developing another fibroid.
Wow.
So we are saying that the reason why you need to do the fibroid, if it's not really necessary, you don't need to do it. But if it becomes so big and anxiety and it's disturbing you, you need to remove it.
Okay. So how do you diagnose it? I come to the hospital, it's like a breast cancer routine check. There's a unit where you go and then you say, I'm coming to check if I have fibroids. Or as you mentioned, some of these symptoms of overbleeding would let the doctor say, okay, let's do a fibroid check.
So most people will come with a symptom.
Okay.
I mean, they're trying to get pregnant, it's not happening. They're bleeding too much, they're having abdominal pain, painful menses. Then this might make you wonder, okay, is it possible that it's fibroid? The next thing I'll do is I'll do a general checkup on you to check if your blood level is low and everything. Then I go to your tummy.
Okay.
I examine your tummy, I touch the different parts, especially towards the lower part of the tummy. Then boom, sometimes you feel like there's a hard or firm mass. It gives you an idea that possibly this could be fibroid.
Wow.
Then the next step is to do a scan. When you do a scan, it's quite obvious. I mean, depending on the size, it's quite obvious. So that the scan will just show you that this is fibroid. And then you go ahead to investigate. Then the scan can tell you where the fibroid is lying. And other parts of the uterus where there's also where the ovary has challenges or stuff. So all these things help us to diagnose fibroids.
Where does it come from? Is it what we eat? Or like, where
I mean,
family?
There are risk factors.
Okay.
So when they say risk factors, it's like something that makes somebody have a higher chance of developing something. So risk factors like race, black race generally, we have propensity to develop bigger fibroids. I mean, some of the fibroids I've seen, they're so huge.
Oh, goodness.
And I mean, just this Saturday, I do fibroid operations almost every week.
Wow.
This week I have 2. I might do 3.
What are the ages of your patients?
The youngest I had was about 20 years.
Huh?
Yes, and she had quite a big fibroid.
What?
So it's like when you start having your menses and your estrogen begins to go up, fibroids they're sensitive to higher levels of estrogen. But as soon as you start having your menses, some people their cells have been programmed to develop fibroids. So knowing that, then when you realize you are developing fibroids, it means that you must make sure that your fertility is not delayed.
Okay.
If anything that is within your control to get pregnant early,
that's what we hear.
You should try.
Look at a 20-year-old. I mean, that's quite some way that she should have a child at that age, or because
there are multiple factors. I mean, there are multiple factors. As I'm saying, if it's within your control, the earlier the better.
Is it also seen in more aged women?
So because fibroids take time to develop, it's likely to be seen later in life.
Okay.
Especially those who have delayed in having their children. When you delay, the thing is that it's estrogen. So if you don't have kids, then your estrogen level, your exposure to estrogen is longer. Especially those who had their menses quite early, and those who have delayed in getting pregnant.
Right.
So there's a lot of exposure to estrogen, and that can turn your cells to develop and become fibroids.
Does reduced bleeding have anything to do with developing fibroids? Lesser menstrual days?
No.
Some women, okay.
So some women will say, it's a myth I hear a lot. That, doc, I am not bleeding, my menses is not coming plenty, it's coming small and it's dark. So, doc, Mujano, it's going to develop fibroid. No, so normally that does not happen.
Okay.
That does not happen. So if your menses is reduced, you can look for reasons why your menses is reduced. But the likelihood of becoming fibroid is really not there.
Okay. Let's talk about treatments. You remove it. What are the side effects of after it is removed? Are there any side effects? Is it done good?
So, I mean, it's always good to have fibroid done by an expert. Especially those who are trying to get pregnant.
Right.
Also, especially those who have very huge fibroids. One of the fears is that people have fear of operations, surgery. And so people will postpone until it becomes so huge.
Even with education, hasn't it become better?
It's difficult. I mean, any human being, when you're going for surgery, is difficult. So they tend to postpone, especially when it's not giving them too much problems. The treatment, there are ways of treating fibroids. You can just observe.
All right.
If it's becoming bigger, then you go and remove it. But commonly, it's what we call myomectomy. Myomectomy is when we just remove the fibroids and we leave your womb intact. There's also the one that will remove the whole uterus. That's what we call hysterectomy, removing the uterus. The other ways that people will say that medication. Yes, I mean sometimes we can give you some injection.
Okay.
But those injections might have a longer side effects. So you can't use them like in perpetuity, trying to shrink the fibroid. So those are very huge fibroids that we want to go and remove. We give them some injection to make it a little bit smaller, reduce the risk of bleeding. So when we are removing it, the bleeding level is low. There are other interventions, like sending some pellets into the vessels that supply the uterus. When you go and block those vessels, it can reduce the the size or the growth of the fibroid. But that might not be good for somebody who wants to get pregnant.
Okay.
So by and large, the commonest way of managing fibroids is the removal of the fibroids.
Okay. How about herbal medicines?
I'm not totally against herbal medications. I think there should be some good in herbal medications. But the thing is, we might not know the content of everything that they are consuming.
Okay.
So, to say herbal medication will cure fibroids, I'm not so sure. But I know there should be some good in herbal medications.
How have you seen fibroid affect the lives of women? How devastating can it be?
Fibroids really are worrying women. I mean, I see fibroids every week. And you can see that people have to undergo a lot of blood transfusions.
During the surgery process, you mean?
Even before.
Okay.
Because they've lost a lot of blood. They need to. And some of them, they could be in pain during their menses. Some of them, their tummy have become so huge. But I removed one recently. The woman said, I feel so light.
Oh.
I feel so light. And fear. I mean, they shouldn't be afraid.
For you to be told your whole womb is going to go, if it comes to that?
So, I mean, it's possible that the whole womb might go, because we can never say never. Because sometimes you remove it and the person begins to bleed. You do everything you want, and then they're like, it's difficult, you need to take off the womb. But to say that, it doesn't really matter the size. Sometimes it's patience. I've spent like 4 hours. This Saturday I spent 4 hours to remove fibroids.
Wow.
That's this Saturday.
Wow.
4 hours to remove somebody's fibroids. And it took me that long because I was determined. She's just young. 33 years. She's just young. She needs a womb. So I took my time, one step at a time. What we do to reduce the bleeding is that we tie the base of the uterus. And that gives us time and the patience to move it one after the other. So we reconstruct the uterus, and sometimes it's nice. I enjoy doing that.
Yeah.
So 5 hours, I'll do it.
What are the success stories? Have you had patients who have had babies after that?
Quite a number.
Oh,
There's one lady who just went to the US. She just came, had a fibroid that this year.
Okay.
About 6 months ago. And when she just finished, I said, let me go and try. So let's check if your tubes are okay. Yes, the following month, this lady came. Dog, it's like I'm not seeing my period though.
Hey!
She's pregnant.
Wow.
So
wow.
happy.
That must be so fulfilling. So fulfilling. So generally, Doc, just before we wrap up, we have to go. What's your advice to women out there, their spouses, the quality of life that we can live?
Women shouldn't be afraid of getting their fibroids removed. I think the delay, most people are delaying too much.
Delay.
If it's giving you problems, the earlier you solve it, the better. And they shouldn't be afraid.
Is it expensive?
It depends on where you're doing it. I mean, in the government hospital, it's a little bit more affordable.
Okay.
But even that, you still have to pay something.
Okay.
It's not too expensive. Okay. I mean, depending on what you need.
Your life and your future children.
So they should contact.
Okay.
Let's see how we can help them.
All right. Where can anybody reach you?
So my hospital is at Taifa. It's called iSecom Medical and Fertility Center. My contact is 0244 922 899. 0244 922 899. My WhatsApp is 0202 640 514. I'm on TikTok as Isaac_Secom.
Hey, Doc, what do you do on TikTok? You post educational videos. Okay. Well, that's very nice and refreshing to know. Doc is a Gen Z, though. Go on TikTok and look for Isaac_Secom and get all the information, the education about fibroids. Thank you so much, Doc, for doing this. Hopefully, we touched lives at home watching us, and more women have made up decisions that they are going to the hospital either to see Dr. Isaac or they're going to the hospital to check for fibroids, because fibroids can be deadly if your bleeding is not coming well, if it's too much, you might want to definitely get your fibroids checked or your system checked. Your uterus may be affected. If your tummy is bulging, you may want to check it. Please, thank you so much, Doc, for speaking to us. Obstetrician gynecologist Dr. Isaac Tetesekom, educating us on fibroids and all what we need to know, separating the fiction from clinical fact. We'll be